Okay, now we have already spoken about all the PT management pre-op and post-op for thoracic uh, pulmonary surgeries excluding pneumonectomy. Now, why is pneumonectomy separately spoken about? Because it has a different type of complication that can arise if you position the patient or if you treat the patient just the same as any other uh, pulmonary surgeries. So now what is all the differences and what are all the complications that can arise if you do a common pattern of PT management? Preoperatively, you will be speaking to the patient about the procedure in a simple format, what is being done and which and all muscles are getting involved and where will you have an incision, and after the what procedure, what and all lines and all will be attached on the patient and all. So you will give a brief idea on the operative procedure, and after that you will specifically tell the patient that after the surgery for approximately 10 days they have to lie on their affected side and do not lie on their good side. ഇത് സ്പെസിഫിക് ആയിട്ട് നമ്മൾ പറയുന്നതിൻ്റെ ഒരു കാരണം ഈ ദ സൈഡ് വെയർ ദ ലങ് ഇസ് ബീങ് റിമൂവ്ഡ്, ഓക്കെ, ന്യൂമോനെക്ടമി ചെയ്യുന്ന സൈഡ്, ആ സൈഡിൽ ദ വിൽ ബി ഫ്ലൂയിഡ് കളക്ഷൻ ഇൻ ദ pneumonectomy space, and if you lie on the good side of your body, the fluid that is being formed in this pneumonectomy space, it will come and cover over the bronchial stump from where the lung has been resected, and on the stump there are sutures. These sutures may break, and this can cause possibly that is called as a bronchopleural fistula. So this is the main complication that can occur only in a pneumonectomy case. So post-operatively you should specifically teach the patient or inform the patient that they should be lying on the same side of incision or the affected side where the lung has been removed. They should lie over that side itself and not on their good side to prevent a complication called as bronchopleural fistula, which is the fluid that is being collected in your pneumonectomy space. This if it comes and comes in contact with the bronchopulmonary stump, this stump can get ruptured and cause a fistula, which is called as a bronchopleural fistula, which has to be prevented. When you're doing this, usually patient has a difficulty that their normal respiratory pattern has been embarrassed by lying on his remaining lung, but this is how you have to be asking the patient to do, and cuff techniques are not promoted because it will cause a back pressure which is traumatizing to the bronchial stump. So എല്ലാം നമ്മൾ ചെയ്യുന്നത് ഈ bronchial സ്റ്റമ്പിന് ഒരു റപ്ചർ ഉണ്ടാവാതിരിക്കുക എന്ന ഉദ്ദേശത്തിലാണ്. ലൈങ് ഓൺ ദി സെയിം സൈഡ് ഓഫ് ഇൻസിഷൻ, asking the patient not to cough, but only huffing techniques should be taught to the patient, and huff ചെയ്ത് ഈ എന്തുവാ ഫൈനൽ സ്റ്റേജിൽ വെൻ ഇറ്റ് ഈസ് കമ്മിങ് ടു ദ ത്രോട്ട് അവിടെ നിന്ന് ജെൻറ്റലി ക്ലിയർ ഔട്ട് ചെയ്യാനായിട്ട് കഫ് മാത്രമേ പ്രൊമോട്ട് ചെയ്യാൻ പാടുള്ളൂ. സോ എവറിത്തിങ് ഈസ് ടു പ്രൊട്ടക്ട് ദി സ്റ്റംപ് ആൻഡ് പ്രിവെൻറ്റ് ഇറ്റ് ഫ്രം ബ്രേക്കിംഗ് ഓർ കോസിങ് എ ഫിസ്റ്റുല. ആൻഡ് നൗ ആഫ്റ്റർ യുവർ പ്രീ ഓപ്പറേറ്റീവ് ആയിട്ടുള്ള ഒരു എന്തുവാ education to the patient, what could be the post-operative problems that you will be facing? Yes, bronchopleural fistula, that is the main problem that we could be facing. Other than that, as usual, pain, decreased air entry on the good side, retained secretions, decreased shoulder movement, decreased mobility, poor posture, just same as the other surgeries. Poor posture, that is tilting towards the same side of incision, that is lowering the shoulder and raising the hip, and decrease exercise tolerance. These are all problems that we are going to face after the surgery. So now what will be our plan?